So there's been a lot of work on following up pregnancies, and of course we will be getting more and more data coming out really relatively rapidly over the next few months, because obviously we've only been delivering the vaccines for a relatively short period of time. But the sort of things that have been looked at so far are the risk of stillbirth, birth weight. Now, birth weight is a very good indicator of the health of a baby, and it can indicate a number of different things. So generally speaking, the smaller the baby, the more concerns there are about the health of that baby. So this has looked at babies who've been born at different gestations, comparing them to the birth weight of babies born in unvaccinated pregnancies at different gestations, but also birth weight. If you just look at it as a rough ready reckoner, it does give you an impression about whether babies have been born early or not. And then another marker that's been looked at is babies who've been born with structural abnormalities, so-called congenital abnormalities. And so far, all the data is very, very reassuring, is that there are no differences in babies born to mothers who have been vaccinated compared to mothers who have not been vaccinated. And these, as I say, I think the important point about these studies is that they have been done in different populations, so they have been done across different countries. We do tend, when we're talking about data in the UK, to concentrate on obviously data that's come from our own national databases and studies, but also on the data that's come from America and Canada, and partly that's because they are not dissimilar populations. I mean, there are some very important differences, of course, but also it's because these are the countries that have set up such large databases. There's a couple of different reasons why we've looked at why we look to these types of publications. And I think there was another similar question that I saw is have different ethnic minorities been, or different ethnicities, I should say, because they won't necessarily be minorities in different populations, been included in the research that was done initially on the vaccine and also on the follow-up? And the answer to the question is yes, different backgrounds have been included.